Hello, and thank you for taking the time out of your day to hear about my preceptor experience from the fall. Life is not the same anymore, and over many months, we have had to adapt and overcome those challenges and changes. Being a preceptor in the fall of 2020 with no athletes was the biggest challenge of 2020 for me. And I just want to share how I pivoted as a preceptor during a pandemic. I am the full-time athletic trainer at Thomas Jefferson High School for Science Technology. This will be my 20th year and definitely my most memorable. I have been a preceptor for George Mason University since 2010 and have been an adjunct instructor for the last 8 years. I am currently pursuing my Doctorate of Education through A.T. Still University and look forward to my 2022 graduation date. Thank you to Dr. and Mrs. Caswell and Dr. Lacayo for encouraging me to share this endeavor. My intention for putting this presentation together is to share one example of clinical education during COVID-19. There were 5 other preceptors working with George Mason University this fall, and I am sure we all did something different to fulfill the requirements given to us. Given my classroom experience and recently converting my spring courses to a hybrid model, I wanted to experiment with that with clinical education. I'm going to highlight how I used evidence-based practices as a preceptor, as well as introduced evidence-based practice concepts with the athletic training students. I've had the great pleasure of overseeing the clinical education of over 20 athletic training students, 2 of which I hired to work with me when they graduated. Preparing students to transition from ATS to ATC and into a new setting as an employed professional is one of my great passions and joys. I can't imagine my own daily practice without being a preceptor. It is rewarding, and if you aren't currently a preceptor, then I hope this might inspire you to reach out to your closest ATEP and volunteer. If you are a preceptor, then maybe you will see something you can add to your practice when things do return to normal. George Mason University has over 100 athletic trainers in multiple practice settings, providing clinical education sites for their athletic training students in the DMV area. If we were able to be together, I would ask for a show of hands for those of you that are preceptors. I would survey the room and ask for a show of hands if you had a preceptor who made an incredible contribution to your education and current clinical practice. Take your phone out. Give them a shout out on social media, send them a text, and show them your appreciation. None of us would be here without those volunteers who wanted to serve and give back to the profession and strengthen the next generation of athletic trainers. I don't consider being a preceptor as a second job. Athletic training at TJ is intertwined with being a preceptor, and I can't imagine doing one without the other. If your mindset is that being a preceptor is your second job, or that your full-time position is your main priority, re-examine that practice. Is your current athletic training student suffering because of that mentality? If you are a preceptor, then you know the juggling act between your own clinical practice and job responsibilities and socializing your athletic training student to the profession. This time, if we were together, I would not ask you to raise your hand. Perhaps you had someone that volunteered, but it turns out they didn't have the skill set needed to be an effective preceptor. And that's okay, it isn't for everyone. Widener and Henning discussed the skill set needed to be a successful preceptor. Keep those effective and those less than effective preceptors in your mind as we examine desirable preceptor skills. Preceptors need to be effective communicators that can clearly articulate their expectations of their athletic training student. Preceptors need to be comfortable with delivering positive and negative feedback with discretion and empathy. They also need to establish an open dialogue with their athletic training student so the student feels comfortable with asking questions and advocating for what they need from their clinical education. With as much time as we spend with our athletic training students, there are times when we need to fill the gaps in action with getting to know the student and showing genuine care and concern for them as a person. You know you have taken the time to get to know your athletic training student when you know their parents' names, siblings, their childhood pets, favorite foods, and all their previous injuries. We model appropriate interpersonal skills when interacting with our athletic training students and our athletes. This is the opportunity to model cultural competence with both the athletic training student and our athletes present. Demonstrate that words matter. Supervision occurs on a spectrum. As the athletic training students progress through their education, they should become more autonomous. As their confidence and skill set grows, the less supervision they will require. When athletic training students are in their last rotation of experience, I frequently turn over the athletic training room to them where they are in charge of managing the chaos. However, they should always be within earshot or field of vision of their preceptor. Being a preceptor is more than just having excellent clinical skills. They must be able to teach those skills, breaking down concepts, explaining the why, encourage problem solving and decision making, challenge student responses, and bridge the gap between theory and practical application. Preceptors must be able to give up control and provide opportunities for athletic training students to complete evaluations, treatments, rehabilitation protocols, administrative tasks, and communication to stakeholders. While the athletic training room chores are inevitable for all athletic training students, I tell mine that I would never ask them to do something that I don't do myself. They are not here for just filling coolers and folding towels. They will learn by watching, by doing, by failing, and by succeeding, but always within earshot or field of vision of the preceptor. Preceptors should continuously provide feedback to the athletic training student. Reinforce, redirect, and correct. It should be timely, occurring soon after the event. Reinforce good practices like taking initiative, choosing good evaluation techniques, and applying correct injury prevention techniques. Provide constructive criticism without belittling. Start a reflective question. What do you think you could have done better? Do you think that you made any mistakes? Next time, what will you do differently? I tell my students that there are many ways to do something, and if you do it different than how I would have, that's okay. But I'm going to show you another way to do it, and so when you are in charge, you can choose which way works best for you. Frequently, especially in the beginning of their experience, I will ask, what do you like? What do you want to change? What do you want to do that you haven't done yet? This helps establish goals and take control of their own learning and gives us something to talk about on the golf cart. Preceptors should have confidence in their own clinical competence. Think of that 4-year-old that asks why to everything his parents say. Preceptors should be able to explain the rationale behind all of their actions. For new athletic training students, this explanation should usually be stated when a new task is being shown and without them asking why. Why are coolers filled hours before practices and games start? Why do I let athletes call home and talk to their parents first before I jump in? Why do I send emails even if we made a phone call? Why do we record conversations in our electronic medical record even if we didn't touch the patient? As a preceptor, we need to remember that the athletic training student doesn't know what they don't know yet. It will take some extra effort into covering the justification for just about everything we do. As athletic training students get more experience, the preceptor can prompt them to answer, why do you think I did it that way? We use this graphic because our stakeholders don't always see everything that we do. The same could be said about our athletic training students. We can't assume that they are observing and understanding everything that we are doing. Administrative skills. This is where I really feel I have failed the students in the fall of 2020. They did not get to see normal administrative skills. This is an area that we know they need the most exposure and understanding in, as there is a huge gap when they leave from being a student to a professional. Feedback that I have to give my students all the time is that things need to happen faster and be more concise, because after school you will be doing multiple tasks at the same time. As preceptors, we need to remember this, that the students did not receive this skill set or see this skill set, and moving forward, we really need to emphasize to them the importance of being able to multitask, time management, and how delegation is very important as an athletic trainer. Continuing education. You're doing it. It's our professional responsibility to maintain our certification and licensure through professional development. But how often do you attend an educational session to hone your preceptor skills? The NATA does offer a Master Preceptor course with 4 modules. It can be purchased through the NATA website for $67.50, and athletic trainers can earn 4 CEUs with 1.25 being evidence-based. I've had this on my list of things to do since COVID-19 in March, and I need to stop putting it off for other assignments and projects. I'll get around to it. As preceptors, we should encourage our athletic training students to attend state, district, and national level student programming. We can consider it a big win when they use something from their own clinical education to present to their peers at these conferences. Thanks to my preceptors, I learned it was never too early in your career to become an NATA member and attend conferences and serve the profession. Dr. Candace Lacayo approached us in early August to see if we would be interested in being a preceptor, giving us a couple weeks before classes started to develop a plan to meet the requirements. I wanted to create a hybrid model where I met with the athletic training students online as well as face-to-face. Being a preceptor during COVID-19 with the given format came with several challenges and variances. First, usually I only had 1 or 2 students at a time, and now I had anywhere between 3 and 5. I had such a brief time with each student that it took an extra effort to get to know them individually. Before our first session, it was important that they completed that introduction slide. Now, there were no athletes. When there are no athletes or patients, then it looks like a classroom, not a clinical education site. So everything had to be fabricated by myself, my tutor, and the athletic training students. FCPS and TJ had a strict no visitors policy. I requested that the athletic training students be allowed to access TJ since I was overseeing them as part of my job, and I was denied. So for 12 weeks, we held our face-to-face meetings outdoors. Luckily, with the practicum I was assigned, it worked out well. There was only one day where we had to put up a tent. We did meet on the George Mason campus a couple of times if poor weather was expected. Since it was just me and them, it severely limited the socialization of them to the profession. Usually opportunities just present themselves, but now it was up to me to depict gaps and fill them in on the spot. During the week we covered spine boarding, the athletic training students asked about how to remove athletes that didn't need a spine board. So we reviewed manual transportation as seen in one of the pictures. My main focus and lesson planning were to cover the required educational content, and that did not leave much room for improvising or veering off topic. One of my favorite things to do. So for the first time as a preceptor, I had to motivate the students. They had had enough of virtual learning and using standardized patients. They wanted to do something real. So I had to create virtual activities. And this in-person activity where we played bingo for what was in the crash bag. The winner got a $10 Starbucks gift card. Athletic training students were able to complete their spring practicums. However, they missed a summer and a preseason rotation and then also needed to complete their fall practicum. Each practicum lasted for 4 weeks and the athletic trainer students rotated to different preceptors. Each preceptor taught their assigned module for the whole 12 weeks. As soon as I accepted Dr. Lacayo's invitation, I started working on my module design. I spent some time reflecting on what aspects of being a pre-COVID-19 preceptor I needed to transform and include. The hybrid model lends itself well to the BOC test prep. The ultimate goal of any preceptor is to complete those proficiencies, so everything I develop would be for the benefit of checking them off and scaffolding those skills for real-life application. I had second-year master's students, so I wanted to combine my passions of emotional intelligence and transition to practice with evidence-based research to focus on those skills that we know newly certified athletic trainers struggle with. Online educators know that student engagement is so important and has to be developed. One of the best technologies for teaching online is using a learning management system. Classroom educators have access to Blackboard or Canvas, but preceptors don't, so I had to create my own LMS. Google Drive is something I've used as an adjunct instructor in combination with Blackboard, so I used a resource I was already familiar with. Hybrid learning and not having any real clinical work gave me more time to focus on evidence-based practice. Position statements and consensus statements are often things that I would just sprinkle throughout the semester when the topics arose. Now I can cover them more in depth as a teacher and then transfer that knowledge to actual skill development. As athletic trainers, we understand the importance of documentation. Athletic training students are introduced to documentation during their evaluation and rehabilitation courses. But it is in their clinical education that they are truly exposed to documentation protocols and formats. Neal et al. References that employers of newly certified athletic trainers found they are most troubled by the logistics of this administrative skill. Knowing that this gap exists, I do everything I can to prepare my students for professional practice. My athletic training students document all their patient care they deliver. And depending on their experience, this could be by creating the record, just adding a note, recording the treatment, or doing all of it. They experience doing it in real time, so as the evaluation or treatment ends, they're documenting it. They could be doing this for multiple patients, so as we know, this is a mental task that requires a good working memory. Until athletic training students feel confident that they can recall all the details, I do allow them to take notes on their phone or a notebook. Some students will keep track of the injuries and treatments in their manuals. I'll read their notes and give feedback, items missed, or not needing to be included because it's redundant and time-consuming, and students can sign the record with their initials. Everyone records differently, and while there are absolute items that must be included in the record, athletic training students should be exposed to a variety of documentation methods. Where we pivoted for COVID-19, the athletic training students had to write a note for each student-patient encounter. Emily and I would later write up our own notes for the same encounters and add them to the Google folder so that they could see our versions for comparison. Athletic training students will definitely need more time with this skill before graduation in their other clinical education sites. At some point, all preceptors have used a standardized patient to complete a proficiency or introduce a skill. We've had to use them when a real encounter is not possible. This is quite common with the pre-season practicum. In a safe space where mistakes are allowed to happen, students can hone their evaluation and treatment of emergencies. Emergency head neck injuries, exertional heat illness, cardiac emergencies, and a musculoskeletal emergency. And one positive from this multiple student format is that they could respond together and practice teamwork, one of many soft skills that can be honed with a standardized patient. Soft skills are those non-technical skills, the skills students all need and are included in the assessment of their technical skills. Here are a couple of examples. Communication is a soft skill. Students need to practice verbal and nonverbal communication. Practice active listening. We see this all the time when the athletic trainer students get in robot mode, taking a history and forget all the responses from the athlete because they were too busy thinking of the next question to ask. Critical thinking and problem solving. You can do this by throwing a curveball during your students' evaluations. I did this with our weather proficiency. The athletic training student had to enact her emergency action plan for lightning, and I asked if the order of the coaches and teams that she told mattered. Leadership. Here I saw this during our medical timeouts. They assigned their own roles to each other, and so it was interesting to see how roles were delegated, voluntold, or volunteered. Conflict resolution is a soft skill, and can't we always use examples from our real life to help them with conflict resolution? Positive attitude is a soft skill. I saw this with our standardized patients because these took a lot of acting skills. It took a lot of buy-in for this format and patience. Standardized patients are also good for developing cultural competence. This is patient-centered healthcare for all cultures and diverse populations, which include individuals of different races, ethnicities, religious affiliations, and socioeconomic statuses and sexual orientations. Using Emily, who is an athletic trainer, led to higher fidelity. She knew that what they were supposed to be doing, so corrections were more authentic. She knew how to answer history and evaluation questions. And if you're going to use a standardized patient, they need to be prepared and coached well beforehand for as close to a real experience as possible. In recent years, there has been much more emphasis giving athletic training students opportunities to interact with members of other health professions. Successful collaboration with other healthcare providers will lead to better patient care and better patient-reported outcomes. Interpersonal communication occurs with our stakeholders, all those individuals that we interact with on a continuous basis. This is a very important soft skill and one that the athletic training students can practice every single day with every athlete or patient interaction. Feedback that I had to give this semester for communication was to coin another response to questions and answers rather than, okay, cool. His tibia and fibula are fractured. He doesn't think that was cool. When interacting with our stakeholders, we need to stick to the facts of the situation. It is not our job to make everyone an expert on every injury and medical condition. Give them what they need to leave your care and ensure that you will follow up with them. We all have those spiels. Athletic training students should be given opportunities to ask those questions that athletic trainers we get asked all the time. Why do we ice? Why do we heat? What are shin splints? What are the symptoms of a concussion? Hey, athletic training student, why don't you answer their question? During this module, most of the interprofessional communication occurred with EMTs, the team physician, and school nurse. Here are several examples of methods we used. We used a medical timeout. I introduced this concept, and before each of the emergency situations, the students met as a team. We also did this on one of our Zoom calls, and I showed a video of a medical timeout that took place before spine boarding. In a majority of the standardized patient encounters, the athletic training students had to call home and inform the parent of the injury. Athletic training students also simulated calling 911 and talking to the dispatcher. When EMS arrived, an athletic training student was delegated as to who would turn over patient care to them. Oftentimes, in the BOC scenarios we did on Wednesdays, students learned when they needed to notify the team physician, school nurse, and athletic director. Here, they learned TJ's chain of command when we had to notify them of emergencies, and they would have to state that in their plan and follow-up. We incorporated interpersonal communication with several prompts during proficiencies in practice. Like, a first-year athletic training student asked a second-year athletic training student, why are athletic trainers so obsessed with the weather? We also had them where a coach needed to be educated on asthma, sickle cell, and diabetes. When the standardized patient was a visiting athlete, the athletic training student had to call home to their athletic trainer and inform them of the injury. Here we've taught that words matter, that confidence matters, that active listening matters. This might be the first time this stakeholder has ever interacted with an athletic trainer. What kind of impression do you want to leave with them? Here is how I set up the modules. I established the theme, Preventing Sudden Death, and reviewed that consensus statement. I found that 8 out of the 10 causes of sudden death in secondary schools were covered in our preseason proficiencies. So I created a folder for each of those. Then I needed to organize the proficiencies and topics that we would cover for each week. I did not do a good job of this with the first group, and later reorganized the topics for groups 2 and 3. The other thing I realized is that the athletic training students needed a refresher for on-the-field evaluations and documentation, and I added that to week 1. For each topic, I went to the published NATA documents and resources. I found websites and videos for the athletic training students to view during the week on their own, and some that we watched together on Zoom. I created the pre and post test with topics of fitting equipment, medical conditions, and weather-related issues from the multiple choice questions in the BOC review book. I went through that book and also pulled all the scenarios that related to our topics. These were items I created in the Google Drive and placed in their Google folder or had them complete throughout our time together. Here is a picture of our schedule. Let me give you a tour of the Google folder. This is the instructor folder. This is where I house the BOC scenario answers, the evaluation forms for each group, and their pre and post tests, with the most commonly missed answers that I put into a Google Doc, and we went over those on Wednesdays. Each group had its own folder, so we're in the preseason 3 folder or group 3's folder. You can see that each topic that we were going to talk about has its own folder. There are also folders there for when we needed to fill in gaps. I started off with the introduction slide. So students on the first day created a slide and introduced themselves to us. Now they already knew each other because they had been rotating around for over a year with each other. So this was more for me to get to know them and for them to get to know me, which is very important in engagement. I also gave them a tour of the athletic training room. So I recorded myself giving a tour and put that in there so that they were able to feel connected to the athletic training room even though they couldn't go in. I opened all the cabinets and showed them my supplies. I also had a layout where what we were going to cover each week. Each week had its own tab filled with resources. So even though they were also in each of the folders, there was a way for them to just click on the link and go to it if they needed to. So here, if we go to preventing sudden death, I gave them other resources other than just the NATA when they went to this and told them about KSI as well. So that was easily at their fingertips for them to use. I started off with the theme of preventing sudden death. So that was what we covered first. And there were 2 documents in there that I created the presentation for. So we all opened these up on our Zooms. And I used the Inter-Association Task Force for Preventing Sudden Death and Secondary School Athletics Best Practices document. And so this is how I introduced each of the topics on that very first week before we went more in depth with them. I filled gaps in knowledge, so the emergency action planning was here with TJ's emergency action plans. That way they knew what the address of TJ was and doors and gates to use during their Friday proficiencies. In inclement weather, we didn't need to cover cold weather, but I filled that gap as well. Another way that I kept students engaged with the filming videos is I recorded myself using the digital psychrometer and taking a wet bulb so that they were able to see me using it before they came to the proficiency on Friday and what our protocol for that was. That way they were just introduced to it better before that day. There were some other items in here, as I mentioned before, the SOAP notes, so they saw sample SOAP notes, and then the BOC scenarios for the topics that we introduced each week and then went over the answers. I'm going to show those in a separate video. If at any time you want to see more information that I have in each of the folders, just reach out to me and I will be happy to share. Each week, the students had a learning activity that I used from the BOC review book. These scenarios were great. The other reason I love to use the Google Drive or Google format is because it is real-time collaboration between the students. So they could meet together outside of our own meeting time and work together on answering these BOC scenarios or work together. And I've used this in my classroom at Mason, and so it was definitely something that I wanted to carry over. So we're going to take a look at the week 1 wound care scenario. And again, I copied these scenarios straight out of the BOC book. So here we have a field hockey player who gets hit in the eye with a ball. And there are going to be items that the student would perform, and they have to rank how they would do that. So what action would be most appropriate to most detrimental to the athlete. I had them color code this, and this was to apply learning preferences, and that we know that visual learners prefer things color coded and use different colors. So we used green for most appropriate, that yes, green was good, and that red was bad. And so yellow and orange and blue kind of in the middle. And so you see the highlighted answers, and those are answers that after the students completed this, before we met, I went in and highlighted the answers that matched the BOC book. This gave us an opportunity to create dialogue on what is the difference between real life and theory. So something that came out of a textbook. And the students really enjoyed the highlighting and seeing the difference and the discussion, and Emily and I were able to talk about items that had come up and used real examples. So the first one you see here is remove the face mask is under most appropriate. And when I show you the answers, this created quite a dialogue between us, so it was great. So as you go through the rest of this, the other thing that I really wanted to reinforce is perhaps they had used this BOC book before, and I didn't want them to just be able to copy the answers out of the back of the book. So they couldn't just write the number of the selection and under which heading it fell under, so they had to write the whole answer. And again, this is just one of those instructional strategies to reinforce what they're doing, and they couldn't just go in and write answers. The BOC uses pluses and minuses and zeros, and so I wanted to create a different format to reinforce the idea. And I also just love that they weren't perfect. So you can see that not every answer was highlighted, and we learned best from our mistakes. And I told them I didn't expect them to be perfect, so it was much better that they weren't. So when we take a look at the answers, in that first scenario, remove the face mask by the BOC was yellow. And what we had to talk about was that BOC book was in 2017, and perhaps the rule had changed since then. I don't remember when it changed, that field hockey now wears goggles. And so it would be appropriate to take the goggle off to look and check out her eye. So this was an opportunity to just go through things that had changed and apply real life. So the students love these activities. It was something for them to work on. And this is something that I would use moving forward. With multiple students, one of the ways I had to pivot is creating a variety of scenarios for proficiencies, since they can't all do the same one. So I wrote numbers on little slips of paper, and students drew them for a scenario that I created. I'm just going to list a couple of the proficiencies I used for ideas. For asthma, we had a visiting athlete having an attack, and we had a cheerleader who did not respond to treatment. And the third scenario is this athletic training student had to educate the coach on asthma. For our cardiac proficiency, we allowed them to work in pairs or as a group. So the two scenarios we used were a spectator having a heart attack and commotio cordis. And throughout our time in the modules, we had several reports of athletic trainers saving lives from cardiac events. So we used that media that I found throughout the module. For emergency action plans, students had to incorporate TJ's emergency action plan in their proficiencies using our address and field location, knowing which hospital we go to, and they had to know the items in our crash bag. For emergency head and spine, we reviewed two different types of scenarios, and we assessed on a combination of the two of them, where the athlete had loss of consciousness and then regained consciousness with several of the red flags that would include spine boarding and referral. For emergency musculoskeletal, we used several examples from the NFL, and students had to create their own. This exhibited that they didn't know the difference between an injury and an injury that is an emergency. I found that they wanted to call 911 for everything. This is a novice mistake. We corrected it by building confidence, doing multiple attempts, creating a mental flow chart for them to use in the future. For fitting helmet and shoulder pads, we found that there was a gap of knowledge that they didn't know what proper hitting techniques were. So I supplemented that gap with videos from the NATA on good tackling techniques. Inclement weather. The proficiencies we had them do were measuring the wet bulb and the wet bulb globe and making appropriate adaptations to them, and then communicating that to the coach. So insert a chance for conflict resolution. We also told them that that is not the time to educate the coach, that should have been done before the season started. A lot of them wanted to take time during practice to educate the coach on what a wet bulb was. Here we also found a gap in knowledge that we needed to supplement with heat acclimatization guidelines, and it was a chance to compare what the NATA recommends and what FCPS protocols are. For heat-related illnesses, we went over the exertional heat stroke gold standard and how to treat without the gold standard of rectal thermometry as well. For a lightning emergency, they had to do an emergency action plan with lightning on campus, and then we also did that communication where they had to explain why athletic trainers are so obsessed with the weather. For diabetes, we had scenarios where there was hypoglycemia, hyperglycemia, which happened on a game day, and then also they had to educate the coach on diabetes. For sickle cell, we had a sickling crisis during a preseason workout, so perhaps the athletic trainer was not on site. One where it was the first week of football, and then a scenario where they had to educate the coach on best practices when you have an athlete identified with sickle cell trait. For wound care, we had all sorts of examples of knee and elbow abrasions, blisters, and lacerations. This is where we really emphasize that follow-up with wound care was important. It's more than just covering a wound, and to call home when the athlete needs stitches. With the hybrid model and sort of treating it like a classroom, I needed to quantitatively assess the effectiveness of this format. Group 1's data is missing, and that's because I did not have this formatted correctly for a pre and post test when I first started. My intent with Group 1 was to give them the Google form as a quiz before and after we introduced the information, and I realized that the turnaround was just too quick. So then, during their own module, I created it where we would just do it as a pre-test, and then at the very end we would do it as a post-test. I still didn't get it correct. So there is no data for Group 1 in a true pre- and post-test format. Pre-test scores were not released when the athletic training students took it the first time. So that option was changed for the post-test so students could see the questions that they missed to help guide their future studying for the BOC. After they took the post-test, I sent an email with their pre- and post-test scores so they could see their growth and give them feedback. You might be thinking, what is this? Feedback and an evaluation of a clinical education site? No, this is not something the students normally do for me. It is an important aspect of instruction, and with a hybrid model, this is a function of the classroom aspect. How can I know if I met my goals if I didn't evaluate the students? As I tell them, this is a chance for them to evaluate me as I evaluated them. It is anonymous. I did not collect names or emails on the responses. And I modeled it that everyone deserves feedback and a chance to get better and learn from mistakes. I had never done this before. Please let me learn from my mistakes and cross our fingers we never have to do this again. I love the variety of answers that each student took something positive away from the experience, with the most common answer being that they appreciated the structure and format. The second question on the evaluation form is that I asked them what they liked least about this experience. And there were 3 common themes in these responses: that they wish they had more time, that they wish the time we spent together was more in person, and they wish they had more hands-on experience. And I have to agree with them on all 3 of those accounts. When I asked them about the aspects that were most helpful for them throughout the modules, it made me feel good that I had reached my goals of modeling and teaching good communication and feedback. They liked the open forum setting. They liked that we reviewed when to call 911. They appreciated the PowerPoints, and those are things they can keep with them as they study and go on into their professional lives. The BOC test prep was very helpful for them, and they liked being able to justify their answers. So overall, I think the modules were a success. I asked the students if I had to do this again, what aspects should be eliminated? And it was pretty good to see all the nothings, that they liked most aspects of the modules. It shouldn't surprise anybody that one person wanted to get rid of the group work. I feel you on that. And also COVID-19. When asked what was missing that they wish that we did, it goes along with things that they listed under things that they liked the least. And that was the lack of in-person, hands-on training with real people. They wish that we had more of that, and I can't blame them. I wish we had more of that as well. I do think more case studies would have been helpful. So I agree with that student. The last question on their evaluation form was to rate this experience on a scale of 1 to 5. And I share these for full transparency. Over all 3 groups, the average was a 4.45. For something I created in 3 weeks during a pandemic, juggling new job responsibilities, adjunct teaching, and my own doctoral coursework, I'm very happy about this. We all learned something from this experience. Hindsight is 20/20, and there are a couple things that I would definitely do different the next time. I wasn't quite sure that there was enough material or I had enough to do already that I could have made this experience 5 days a week. I think the next time around, I could definitely make it 5 days a week with more virtual interactive activities going over case studies. I would have also included reflection activities, and these could be surveys that students filled out at the end of their standardized patient encounters, or they could have been journal entries. And I think I might start using these even during normal times, that every couple weeks after some prompts, we sit down and we go over those reflection activities together. I wish I had used high school student alumni as standardized patients. Knowing the injuries they encountered, I could have invited some of the students to sit in on the Zoom calls for us and talk about their experiences with some of the injuries. I did use some real-life examples. I was able to screen capture some mechanisms of injury throughout the collegiate and NFL experiences on the weekends that we showed and talked about during Zoom activities. I'm definitely keeping the evidence-based piece. Students like that, and now that I am very familiar with the BOC review book, I'll know how to draw on those examples next time. I think the students really enjoyed bingo, and I'm going to create more engagement opportunities with them. In the past, I had used the crash bag activity where I gave them a closed bag and 2 whiteboards, and they had to sit down and come up with everything they thought was in the crash bag. Making it a game is a little bit more fun than just sitting down and practice with a whiteboard, so I'll definitely keep that around. Thank you for choosing this presentation to be part of your professional development. Thank you to the VATA meeting committee for providing this opportunity, not only for me to share, but for all of us to stay virtually connected and engaged during COVID-19 and for free. Thank you to the GMU ATEP for allowing me to be unique this semester and encouraging me to share this endeavor. Thank you to my amazing tutor, Emily, who week after week allowed students to spine board her, save her from cardiac emergencies, and immersed her in water for exertional heat stroke treatment. The water was warm. She provided weekly office hours, and I told her that these 12 weeks would be like Preceptor boot camp for her. She has a bright future ahead of her. Thank you to the second year George Mason athletic training students for your patience, your attention, your participation, and a learning opportunity for us all. And to all my previous athletic training students, I miss you and I'm so proud of you. As Taylor Swift says, long live all the magic we made, long live all the mountains we moved. I had the time of my life fighting dragons with you.